everyone. A very, very happy new year. Hopefully, 2023 will be a better year for all of us. At present, I am the chairperson of the Committee on Health and Sanitation, Environment and Ecological Protection. Maraming trabaho pala sa committee na ito. So for this year, what we have done and what we intend to continue is, I'm very happy to report na yung ating geriatrics program for the elderly was approved December of last year. So that means that on the district health center level, we will now have the preliminary assessment of geriatrics. This is the branch of medicine for the elderly, for senior citizens. So, initial assessment sa health center. What will they do in the initial assessment? In addition to the regular, yung BP taking, tapos weight, height, ganon, they will do a testing to determine if you have urine incontinence. Yung bang nakaupo ka lang, naglilik na yung urine, it can be a sign of kidney problems. They will also do tests to determine the nutritional status of seniors. I was surprised when they told me na marami din seniors malnourished. So, hindi lang bata. And then, we are trying also to focus on the bone density issue. This is why we are coordinating with BGH. BGH has now a geriatrics clinic. So, in addition to that, we are coordinating with BGH for the possible operation of their bone density measurement instrument para we'll be able to determine the quality of the bones of elderly. Yung ba osteoporotic? Mga ganon. So, then from this, we will be able to move on to other phases kapag in-examine ang senior at makitang may mga signs, symptoms of possible illnesses of the kidney, of the heart, or the bones, i-refer sa geriatrics clinic sa BGH. This is in line with the universal healthcare program of the city. I think you all know that Baguio is one of the selected LGUs for the implementation of the universal healthcare. So, as part of the universal healthcare, preliminary assessment for geriatrics in the district clinic, tapos kapag necessary, referral to BGH. We are also campaigning for registration in e-consulta. This is a program of PhilHealth, yung e-consulta, na we are encouraging all PhilHealth members and their dependents to register in our district health centers and to undergo at least 2 check-ups sa health centers para they will become regular members of e-consulta. Why are we encouraging e-consulta? Alam naman ninyo ho that with the devolution, yung Mandanas ruling, the share of the LGUs from national has been increased. But, marami naman din-evolve na functions. Yung dating ginagawa ng national, pinapagawa na sa local, sa city at sa barangay. For example, dati-dati, yung mga maintenance medicines were being given by DOH to the city for our health centers. Yung mga amlodipine, simvastatin, losartan, mga ganon. Ngayon, DOH has already sent word, informed us that they will no longer give yung mga maintenance medicines na ganyan. City na raw ang bahalang bumili. So this requires a very huge amount of money to be able to provide all these maintenance medicines. Although in the budget of the city for 2023, we increased the allocation for medicines by 43 million. Dati-dati 20 plus lang, ngayon 60 plus na, 60 plus million. Pero sabi ng Health Department, hindi pa yun sapat. Now, with the e-consulta program of the PhilHealth, for every member who registers in e-consulta and undergoes at least 2 check-ups sa health center, PhilHealth will pay the city 500 pesos per member na mag-register sa e-consulta. And the target per health center is 20,000. If we are able to get 20,000 na mag-register sa e-consulta per health center, PhilHealth will pay 500, so it will amount to about 10 million per health center. And we have 10 PhilHealth accredited. 16 ang health centers natin, pero 10 ang accredited. So imagine if we're able to get our quota, 100 million times 10, o 100, magkano yun? Malaki din yun. So that will help the city provide for the health needs of the constituents of the city. May ordinance na pinapa-approve sa council yung gamot para sa masa, where the city will give free medicines to indigent residents of the city of Baguio. So we need a lot of money. Kaya, especially yung mga seniors, total, automatic na PhilHealth na tayo. Register na sa e-consulta in your respective health centers para ma-meet natin yung quota, para may perang ibibigay ng PhilHealth sa atin, which will form part of the special health fund of the city. Ibibili din yan sa mga gamot, mga iba pang kailangan ng mga particularly the indigent in the city. Pero sabi ko, hindi lang dapat indigent kung may pera ang city. Sana all. This is why, as far as health is concerned, my advocacy is health programs for each specific age category. Diba may programa tayo sa under 5 na? Di okay na yon. Pero dapat may programa din tayo sa mga adolescents, yung mga youth. Hindi lang dapat reproductive health program. Dapat programs din on wellness, including mental health, including yung mga ibang illnesses ng youth. And then, I'm also asking, pati nutrition program. May nutrition program ba para sa mga youth? Panay fast foods ata eh. Kaya, kailangan may programa din targeted to this group. And then we also have to have programs related to other age groups. Yung mga kababaihan na hindi pregnant. Kasi marami tayong programa para sa pregnant women, ano? Yung mga hindi pregnant, bigyan naman ng programa. So we are happy that the city has just signed an agreement for early breast cancer detection. Diba? Breast cancer is one of the main causes of death of mga kababaihan. Ngayon, we will have a program on early breast cancer detection. Yan. And then, sabi ko, sa mga kalalakihan, let's not forget them. So we should also have a health program for men. This is why I'm looking at the possibility of finding out, kaya kapag may PSA laboratory test for men, it can be early detection of possible prostate cancer. So, per age group per category. Siyempre sa elderly, yung sinabi ko na kanina, geriatrics. That's going to be our main program for the elderly for this year and the years to come. I'm very happy that we've started geriatrics. We hope to institutionalize this so that we'll be able to have healthy seniors, prolong the life of seniors. So these are our programs on health as chairperson of the Committee on Health.